And yes, we'll get on with the presentation.
Before we begin, just want to mention QR codes for those who aren't familiar with them. A QR code is a barcode you scan using your smartphone to access information. We'll be using them throughout the session, so you can scan them on your phone if you're watching on another device. Some smartphone cameras automatically detect QR codes, but sometimes you need to download an app. But you don't need to use the QR codes. We will also post the website addresses in the chat. There'll be time to ask questions at the end of the webinar. You can ask questions verbally using your microphone or in the chat. Please feel free to ask questions in the chat during the webinar, though we might not be able to answer them until the end. So you will need to be registered with a GP in your area to access the support we discuss here, even if you self-refer. If you need more information about registering with a GP surgery, you can use the QR code on the left or this website address. You also might want to consider other possible avenues of support available to you, as NHS waiting lists can sometimes be long. Some people might be able to access therapy through work or university more quickly, or even their church. And some private or employee health plans, for example Westfield or Simply Health, might be able to provide short-term therapy as part of that benefit package. What we will discuss during this webinar: what mental health support is available in Leeds, Bradford and Craven and how to access it. Please bear in mind that the people delivering this webinar, which is myself, Alexis, and Lawrence, we're based in the Leeds team, so we're more knowledgeable about services available in Leeds. We have included some information about Bradford and Craven, but if you have any questions at the end that we're not able to answer, we will be able to ask other members who are based in Bradford and we can get back to you with that information. So your rights when accessing mental health services as an autistic adult. How to self-advocate, including preparing for mental health appointments and what to do when you're denied appropriate support or fobbed off by health professionals. Self-advocacy resources available and how to use them. Accessing crisis support, and then questions and discussion at the end. So this webinar today has been developed and delivered by the Mental Health Access Project team, which is myself, Alexis Regalaskas. I'm a mental health access facilitator and I'm also a peer development worker, so I also work on a different project within AIM. Lawrence Querner is also a mental health access facilitator and he's delivering this webinar with me today. And our team is led by Trudy Longbottom and she's not taking part today.
What is the Mental Health Access Project? So MHAP is a free service available to autistic adults across Leeds who are trying to access appropriate mental health services. MHAP aims to support and empower autistic individuals in identifying any barriers that may prevent access to the mental health and other services. By working one-to-one with autistic adults to identify barriers, MHAP aims to put solutions in place which enable autistic adults to improve their chances of gaining equitable access to the support they need. We work with the Mental Health Equity Project to support Leeds Autism AIM's long-term goal of highlighting inequalities autistic adults face when trying to access mental health support. The team are delivering training to mental health providers in order to try and challenge these inequalities, as well as providing audits of mental health settings. What can these mental health access project appointments do? So They can help navigate the mental health system in Leeds and understand the pathways and help understand the pathways to referring for support. Support to prepare for helpful conversation meetings or similar mental health assessments which take place with mental health professionals. We can help to identify any barriers that may be preventing you from gaining access to appropriate mental health support, and then strategies to address these barriers. For example, support in completing self-advocacy resources like the mental health profile. If mental health services offer therapy or treatment, we'll offer a follow-up meeting to address any new or ongoing access issues. For example, making sure self-advocacy resources are being utilised by professionals and any reasonable adjustments are given. Who is MHAP for? MHAP is available to help and support autistic adults from the Leeds area who are having difficulty accessing mental health services. There are 3 different criteria. You only need to meet one of them. Criteria number 1, you have previously struggled to access the community mental health team. For example, you felt your needs were misunderstood and miscommunicated, and this was due to professionals not understanding your autism. Number 2, you're currently on a waiting list for a helpful conversation or an assessment with the Leeds Mental Wellbeing Service. And number 3, you feel you need mental health support but have been unable or struggled to get referral via your GP. There are 2 pieces of legislation you need to be aware of when considering your rights as an autistic adult. Firstly, the Autism Act 2009. This was the first law in England to focus on autistic adults and requires the government to create and implement a national autism strategy, which guides local bodies to support autistic adults effectively. The Act places a duty of care on NHS England to provide relevant services for autistic adults, or arrange for them to be provided by a third party. Next, the Equalities Act 2010, which classes autism as a disability and states it is a protected characteristic under the Act. This gives autistic adults specific rights and certain protections in relation to employment. For example, rights to have provision made in the workplace, like reasonable adjustments, and protection against discrimination, both direct and indirect. These laws can be confusing, and it's difficult to understand all the specifics, but it's important to know the basics about your rights as an autistic adult so you can advocate yourself in different settings, for example, when accessing healthcare services and in employment.
So what mental health support is available? This is just an example. It's a quick reference guide for GPs from the Leeds Mental Wellbeing Service. It just gives you an idea of the different pathways that might be considered when you approach your GP for support. It's not used in all GP surgeries in Leeds by any means because, for example, the Healthy Minds pathway in the middle, that's only available at 5 different GP surgeries. We will link to it at the end of the webinar if you wanted to have another look, but it's just to give you an idea. So in the green, those would be considered sort of lower level interventions and support. So that might be something like a social prescriber or being referred to Leeds Mental Wellbeing Service for talking therapy. If it's felt that your mental health needs are more severe, you might be referred to the primary care mental health teams. That's also delivered by Leeds Mental Wellbeing Service in Leeds. If it's more severe than that, you may then be referred to the community mental health team. We'll go more into this further on in the webinar. And if it's felt that you have acute mental health needs and you're in crisis, you'd be referred via the LYPFT single point of access, which is basically where they triage you into different services available. Support you can self-refer to in Leeds. So it may be that you'd rather not approach your GP for mental health support in the first instance. You can refer yourself for talking therapies through Leeds Mental Wellbeing Service, and it's a free service that can offer you up to 12 to 20 weekly sessions of either one-to-one or group therapy. You can self-refer using that link or the QR code, You'll be asked a series of questions about the issues you're struggling with, and you may then be offered a course of therapy, including group therapy or other treatment and support. There's often a waiting list. Once you have completed a course of therapy via Leeds Mental Wellbeing Service, you'll need to wait 12 months before you can be referred again if you need more therapy. But you can access the primary care part of Leeds Mental Wellbeing Service during this time if needed, and we'll go more into that further on in the webinar. It might be that you're offered something that you feel is not appropriate for you, such as group therapy, when you really need one-to-one support. So you may need to decline what's offered to you before being offered something else more appropriate. There's also the Mindwell website, which is a searchable directory of mental health and wellbeing support available in Leeds. Support you can self-refer to in Bradford. So there's Bradford District and Craven Talking Therapies, and this is another free service for people 16 or over. It provides access to short-term psychological therapies for mild to moderate depression and anxiety disorders. They promote online courses and remote therapy, but you can get face-to-face appointments when needed. You can refer yourself here using this website link or the QR code on the left. Just bear in mind that the online referral is via an AI chatbot, so there is an option on the screen to use a standard online form if that's what you'd prefer. You can also phone them. You'll then be contacted for an assessment, and these are usually over the telephone unless you need face-to-face or other appointment formats such as a Zoom call. Sometimes while waiting you might be contacted by a company called Xyla Digital Therapies and offered the same treatment. I think they're using Xyla to try and bring their waiting lists down. Once you've completed a course of therapy, it's suggested you wait 3 to 6 months before you are referred again, so they're not as strict as the Leeds Mental Wellbeing Service. And there's also the Healthy Minds website, that's a searchable directory of the mental health and wellbeing support available in the Bradford and Craven area. Approaching your GP for support. So these are areas of support that you usually aren't able to self-refer into. You do need to go through your GP or another health professional. So then in Leeds, the Primary Care Mental Health Service is offered by Leeds Mental Wellbeing Service, and it's separate to their talking therapies offering. It's for adults with moderate to severe mental health issues. They may offer short-term support to help you understand and manage your needs, improve your well-being, and help you to access other services. Support is offered through mental health and well-being practitioners, usually based at GP surgeries, but we do have some bookable sessions available at our Lovell Park hub in Sheepscar once a month. An initial assessment chat is called a helpful conversation. Primary Care Wellbeing Service in Bradford. This service is available to people with complex health problems that significantly impact on mobility, mood and everyday living. They're flexible in their approach. They might see you at home, at the GP surgery, at a health centre or remotely. Talk to your GP or lead health professional to be referred. If you want to be referred for a helpful conversation in Leeds, you can talk to your GP or you can contact AIM to see if we can arrange an appointment at the Lovell Park hub. So accessing secondary mental health support or more specialised care. So in Leeds and Bradford, this might be through the community mental health team. So this is for adults with substantial and complex mental health needs which can't be met by other services. In Leeds, they're based in Middleton, Potter Newton and Armley. You need to ask your GP to be referred to this service if they feel it's appropriate. You may also be able to access autism-specific counselling, which you can apply for funding for via your GP. The request needs to go to an individual funding request panel for approval, and there needs to be an exceptional need. Usually this pathway isn't considered until patients have tried the usual therapies available and these have been unsuccessful. More info about how to apply is in our guide linked below, which is our mental health guide. That's on our website, the Leeds Autism AIM website, or you can use the QR code here on the left. Preparing for your GP appointment when trying to access mental health support. Reasonable adjustments. As an autistic or disabled person, you're entitled to reasonable adjustments to make services more accessible to you. If possible, try to agree these with your GP practice in advance. For example, it might be asking for a double appointment for more time to process and express your needs, requesting written summaries of appointments afterwards, or having appointments during quieter times, or having a quiet area to wait in, away from the main waiting room. You might want to write down what you want to say at the appointment in advance. It's easy to be distracted during the appointment or for the GP to lead the conversation. Think about what the issues are, such as what your mood's been like recently, including any intrusive thoughts or thoughts of harming yourself. Difficulties carrying out your usual activities and self-care, such as eating, sleeping and hygiene. Energy levels and any difficulties concentrating or losing interest in things you would normally enjoy. And think about how your current symptoms differ to how you usually are or when you feel you are in a better place mentally. You can also see our GP appointment planner for more guidance, so there's a link to that at the end of the webinar and it's on our website. Common problems and possible solutions. So sometimes GPs and other health professionals do not have a good understanding of autism and what support is appropriate, or they may be overwhelmed and attempt to gatekeep services. Some issues that sometimes arise and suggestions about how you could respond. Referring to Leeds Autism AIM for mental health support. Sometimes GPs will refer to us when formal mental health support is needed. So autism isn't a mental health condition, though these often co-occur. AIM does offer mental health peer support groups, but we are not a mental health service and we cannot offer one-to-one mental health support. Autistic adults also often struggle with groups and require one-to-one support. Sometimes they might not be able or claim to not be able to refer you to a certain service due to being autistic or having too complex needs. So it's important that services know about your autism and take this into account during your treatment, including making reasonable adjustments and adapting your treatment where appropriate, but you should not be refused treatment because you're autistic. In 2015, the Department of Health and Social Care published the latest binding Autism Act statutory guidance, which states that autistic people should have support adapted to their needs if they have a mental health difficulty. You can find more information in our Guide to Accessing Mental Health Services, and there's a link to this at the end of the webinar. So sometimes GPs and other health providers don't have a good understanding of reasonable adjustments and what they are, so they might be reluctant to give what they think is special treatment. Though reasonable adjustments are a legal requirement under the Equality Act 2010 to make sure health services and other services are accessible to all disabled people, and that includes autistic people. They might sometimes claim that waiting lists are too long or the service is overwhelmed, but you have the right to use NHS services. They cannot refuse to help you without a good reason. Some NHS commissioned services have maximum waiting times. You have the right to be seen within those waiting times, and if you're not, the NHS must take reasonable steps to offer you different options to meet your needs. Sometimes they might claim that they can't accept individual funding requests for therapy or counselling, If there is a substantial need for treatment, funding requests can be submitted for mental health treatment in the same way as physical issues. If you're interested in more advanced information about what the NHS and healthcare providers should be doing for autistic people, you can read this document. Now, it's quite long because I couldn't find an easy read version, but it is very interesting, and that's Meeting the Needs of Autistic Adults in Mental Health Services, Guidance for Integrated Care Boards, Health Organisations and Wider System Partners.
Self-advocacy resources. The AIM website has many self-advocacy resources available for lots of different areas of life. Most of our mental health resources can be found here, so we'll discuss some of these in the next slides. There's a link there at the top, and then there is a QR code on the left-hand side of the screen, and on the right-hand side of the image is just what our website looks like, and that is what the heading of the Autism and Mental Health Resources part looks like. Mental health profile. So this is a resource created by the Mental Health Access Project, or MHAP team at Leeds Autism AIM. Basically, it's a form which can summarize your needs, such as sensory needs and also like communication preferences. And then at the end, there's some space for mental health history. So there's like some tick boxes of different conditions that people have. There's also a little space, written box, where you can like put in your any other information that it might be useful to be aware of. There are 6 sections of the mental health profile. So the first one is how I need to be contacted. Second one is what to do if I don't engage. So this is, for example, if I stop replying to emails or don't attend appointments. We have communication needs, sensory needs, ways to help me avoid distress. So this includes like shutdowns and meltdowns. And for example, what you want the professional to do during a meltdown or shutdown, and what you want them to do afterwards. So this is just basically to try and be as clear as possible to these professionals. And finally, the last section is, as I mentioned before, it's mental health history. So this is about talking about conditions and stuff. And there's there's tick boxes with lots of common ones, and then you can write any other needs you have. So why should I use the mental health profile? The mental health profile is good because it can help mental health professionals understand your needs and preferences. Often in a mental health setting, in a quite clinical mental health setting, it can be quite overwhelming, and autistic people especially, we struggle to communicate with people, and also especially mental health professionals in these settings. So what this profile does is it makes it easier to communicate these needs that you have to professionals, which you may not be able to do verbally during an assessment. So now we're going to think about some of the autism and mental health resources we have on the Leeds Autism AIM website. So the first one is disclosure and well-being. So choosing when, whether, or how to disclose an autism diagnosis may be a significant decision which can affect your well-being. It's really important to remember here, there's no right answer about any of these questions. It's completely up to you, and it's what feels right for you. So one time that you may be considering disclosing an autism diagnosis is to your employer. So as mentioned earlier, autism is a protected characteristic under the 2010 Equality Act. And there's also other service, as well as the other service provisions outlined in the Autism Act 2009. This means that your employer must respect your needs as an autistic employee. It's also important to remember, as I said before, there's no obligation to disclose being autistic to an employer. It's completely up to you. In a previous job, when I was diagnosed in the middle of it, I chose not to disclose it just because I didn't feel it was necessary, and there wasn't any reasonable adjustments that I could think of that could have been provided for me in the job. So I just chose not to disclose it. But there may be some reasonable adjustments that you have thought of. And in that instance, it may be a good idea to try and disclose it in order to try and get these reasonable adjustments. There's also another reason why you might want to disclose is in your personal life. For example, disclosing to friends or family, and this can be a cause of anxiety. And again, remember, there's no obligation to disclose immediately or at all. Disclosure, it depends on one person, and that's you. And it's when you're ready. So there's no rush. So how can you disclose an autism diagnosis? Well, one way that it can be useful is through preparation. So through this preparation, this can help you prepare how you're going to do it, how you're going to say it, what words you're going to use. This helps advocate for yourself, and this can ensure that you and your needs are understood by the organisation or the people or the person that you are disclosing to. I can't stress this enough, it's a personal choice. There's no right time to disclose a autism diagnosis. You might disclose it at different times to different people. There might be some people who you see more regularly that there might be more of a need to disclose to those people rather than people you only see every couple of months. This might be less need, or it might be vice versa. Again, it's a very personal thing, and it's also good to take your time and think about whether you want to disclose and when you want to disclose. So now I'm going to touch on some different types of disclosure. So there's preemptive disclosure, which we'll look at first. Basically, this is when you first meet someone, you might just be like straight off the bat, disclose your diagnosis. Or you could also do this in an employability sense. You might do this when applying for a job. You might say that you're autistic. So a benefit of this approach is that it's upfront and you kind of get it out of the way straight away. But I guess a drawback of this approach can be there could be assumptions made about you, and you may encounter prejudice. So obviously, from an employability perspective, it's illegal to discriminate against anyone with a disability, and autism is obviously classed as a disability, but that doesn't mean it still doesn't happen, unfortunately. So that is definitely a consideration with preemptive disclosure. And then delayed disclosure is another type, which is kind of as it sounds. It's where you wait to disclose until a time where you feel comfortable. So an obvious benefit of this is you can build trust in someone, or if you start working somewhere for a few months, you can, okay, now I have a bit of a relationship with these people now. It's sometimes easier to, when you know someone, to disclose. But then there's a drawback to this approach as well, is that sometimes the almost anticipation of waiting to disclose this diagnosis can be quite overwhelming, and it can cause a lot of anxiety to build up. So again, there's no right or wrong approach, and you may choose in some instances to preemptively disclose, and in some instances to delay disclosure or not disclose. Again, it's a completely personal thing, up to you. These are just two different approaches. And finally, I want to touch on partial disclosure. So this is where you disclose your needs. So for example, you can say to an employer I would like to have these reasonable adjustments put in, or let's say towards family and friends, you can talk about some needs that you have in certain social situations or certain situations, and you can say what these are without actually saying what the diagnosis is. So you can talk about your needs without explicitly disclosing that you're autistic. Carrying on with disclosure and well-being, disclosure and unmasking. So disclosure may be an important step in unmasking, which can have a positive impact on well-being and self-acceptance. It's important not to rush this, however, as both masking and non-disclosure are often connected to feelings of being unsafe, which is why people do it. We're going to touch more on masking in a next slide. Dealing with the stigma. Unfortunately, autism disclosure can still result in misunderstanding and stigma. In the workplace, this may come in the form of discrimination. In our personal life, this could be implicit or explicit judgment from those around us who we disclose to. Finally, it's important to think of self-care after disclosure. Disclosure can be a relief, but it may also bring stress. Self-acceptance is an important part of this self-care. Peer support groups can help with mental well-being and providing strategies and support for issues you face. So especially like autistic peer support groups, because it's likely that other people in that group will have been through the same things that you are doing and done the same kind of umming and ahhing about when to disclose. So it's definitely a nice environment to be in. And then finally, it's good to kind of rethink and set boundaries. So social boundaries, like now when you have your diagnosis, maybe there are certain social situations that actually realize you're not comfortable in and you want to kind of like not try and not involve yourself in them, and you can tell family or friends about this, you feel comfortable. There's also sensory considerations. So maybe you don't want to go to like a busy place with lots of people and lots of noise, like a busy bar or a busy restaurant. Or somewhere like a shopping centre where they have bright lights. That's another sensory consideration. And then it's also important to manage energy. And again, this is a completely personal thing. Like sometimes everyone has a different level of energy, and also this level of energy fluctuates. So one day I might have quite a lot of energy for like socializing and doing other social activities. Another day I might have less, and it's kind of like knowing that it's okay. Both days are both okay. It's okay to have the energy to do it. It's also okay not to do that. So yeah, this is another one about autism and mental health resources. So this one's about masking and mental health. Masking consists of learned and practiced behaviors to allow you to better fit into neurotypical spaces. Autistic people mask for a whole variety of reasons. Masking can be a conscious or subconscious response. We can also mask consciously and subconsciously at different times. Subconscious masking is often a learned response to avoid stigma and invalidation or discrimination. This can develop from an early age. This means that it can also be quite hard to stop doing this because it's kind of such a learned response that we actually have to unlearn it, and that can take quite a lot of time. But despite the positives of helping autistic people navigate situations, there is research that shows that masking often comes at a high cost. Taking time to unmask when you feel safe to do so can make a major difference to mental well-being and avoiding burnout. So I'll end this slide on masking and mental health with a great quote from Helen Ellis from the book Autism and Masking. Decide for yourself when and how you want to mask. Have the confidence to be your authentic self, but also don't put yourself down for strategically retreating behind the mask occasionally. I think this last part is really important. Like, while it's good to unmask from time to time, there's no shame in like resorting to masking again. It's got to do what works best for you. So now I'm going to briefly just touch on some other autism and mental health resources we have on the Leeds Autism AIM website. Sleep and mental health, autistic burnout, anxiety management, management of conflicting needs, loss and grief, sensory needs and mental health, and setting and maintaining boundaries. So all these can be found on the Leeds Autism AIM website, which we've put some links in the chat, and we'll post another link at the end. And a new thing we have on our site are mental health access resources. So these are resources specially made for the Mental Health Access Project, which is who myself and the rest of my team are all involved in. So we have a link in the chat, and we also have a QR code on the left-hand side. So we have a self-advocacy guide for accessing mental health services via your GP. And we also have a useful resource called the GP Appointment Planner, which can just help make the process of going to a GP appointment less overwhelming and kind of break it down.
So this is the final section of the webinar before we move on to the questions and answers and discussion. So that's accessing crisis services. Now this is in Leeds, but I've also put the red B symbol next to services that are also available in Bradford or nationally. So you can dial 111 for 24/7 crisis mental health support through NHS 111, or dial 999 in a mental health emergency. So other places to call in a crisis There's a Connect helpline, which is a survivor-led service offering emotional support to people in Leeds. It's open every night from 6 p.m. till 2 a.m. and it's free phone. There's the Connect BSL helpline, which is for deaf people and those who use British Sign Language. And that's available every Monday, Wednesday and Saturday evening from 7 to 11 via text or FaceTime. You can also email them. There's the West Yorkshire 24-hour mental health helpline, which offers support, advice and information for anyone in Leeds. I know it does say West Yorkshire, but there is a more appropriate helpline coming up for the Bradford area. There's the Samaritans, that's always open to talk about whatever you're going through. That's 24/7 and that's a free phone number. Night Owls is a confidential support line for children, young people, their parents and carers who live in Bradford, Leeds, Calderdale, Kirklees and Wakefield, and that's a free phone number or text. And also NHS 111, which we already mentioned, which is a free phone number, and that's open 24/7. A GP emergency appointment. So you can ask to talk to the first available GP. GPs see many people every week who are worried about their mental health, and they may be able to offer a 24-hour service out of hours. There's the Here For You, formerly Wellbeing Hope in a Crisis Cafe, that offers a safe and confidential space for people experiencing crisis in Leeds. That's open 7 nights a week from 6 p.m. till midnight. They offer face-to-face support and also by phone. You need to call or text before visiting. There's also Dial House, which is a place of sanctuary offering emotional and practical support to people in crisis in Leeds. They're open Monday, Wednesday, Friday, Saturday and Sunday, 6 p.m. till 2 a.m. and they offer face-to-face support on the phone and video chat. And there's also Dial House at Touchstone, which offers support to people from black and minority ethnic groups, and that's support by phone on Tuesdays and Thursdays from 6 p.m. till midnight. There's also support by text or online chat. So Connect Online, which is connected to the telephone service mentioned earlier, is a local survivor-led online chat service for people in distress in Leeds, and that's open every night from 6 p.m. till 2 a.m. via their website. There's also the Shout text service, which I believe is national, and you can text Shout to them anytime, 24/7 for support. Messages are anonymous and won't appear on your phone bill. I know sometimes people do struggle to get support from them if they are overwhelmed, so just bear that in mind. You can also email the Samaritans, though bear in mind that they might not get back to you until up to 24 hours later. There's Sign Health Crisis Text Service for deaf people, and then there's the NHS 111 online system to get help for your mental health symptoms, and that's the 111.nhs.uk website. Accessing crisis services in Bradford. So in addition to the previous slides where I highlighted the services with the red B, this is the support available for crisis in Bradford. It's actually Bradford, Airedale, Wharfdale or Craven. So you do not have to have used any mental health service before, and where possible the person who is experiencing the crisis should contact the helpline. But when this is not possible, first response accept contact from a person concerned about someone. Now I realise that this is just a phone option, which makes it inaccessible to some autistic people, especially if you don't have somebody else who can contact the line on your behalf. I haven't been able to find another way of accessing this service, but if anyone is interested in finding out about other options, just let us know in the chat and we'll get back to you another time with more information.
Okay, so that brings the webinar to an end, and now we're going to have some time for questions. So I think we're also going to stop recording now. So don't worry about don't be embarrassed about asking any questions. Don't be worried about where it's going to go. The recording will stop and it will just be of the webinar. And so, yeah,